Treatment of weak inhibited muscles utilizing your proprietary RAAS waveform in your TheraTouch EX4 and CX4 combo unit. RAAS stands for Rapid Agonist Antagonist Sequencing. The treatment approach in this particular case will utilize the RAAS waveform to the agonist and antagonist muscles that produce a sustained muscle contraction that can be integrated into a functional movement pattern. The mechanism of action is believed to mimic the triphasic muscle firing pattern seen in healthy individuals, the agonist-antagonist-agonist pattern. The clinical example in this particular case, dealing with the flaccid wrist and finger extensors in a patient that is status post-stroke. Channel 1 will be placed over the wrist and finger extensors like you see here, and channel 2 will be placed over the wrist flexors. The patient rolls his hand over. You can see that we have positioned the 2 electrodes on the wrist flexors. Now, a special note with working with this waveform is that it may take 1 or 2 times to position the electrodes in the correct spot or location on the extensors and flexors to make sure you're getting the right pattern and the right movement pattern and the right firing pattern. So keep that in mind. When we're talking about dosing the intensity for a sustained muscle contraction, increase intensity of both channels to a submaximal motor level that promotes muscle contraction, which is stronger in the extensors than it is the flexors, to produce a net movement into extension. The patient should be instructed at that point in therapeutic exercise and functional tasks while the stimulation is on. This is the preferred method with RAAS because it does promote active participation by the patient. Setting up the protocol for this treatment consists of selecting the electrotherapy option, manual option, the RAAS waveform, and then the asymmetrical RAAS. Make sure we're using and adjusting the channels correctly. In this case, it's channels 1 and 2. And now we want to adjust the parameters accordingly. So in this case, we want a frequency of 40 pulses per second. We'll make that adjustment here. Next, we want a phase duration of 200 microseconds. So we'll make that adjustment. Next, we want a cycle time of continuous, which is what the default shows us. And we want a burst duration of 5,000 milliseconds. At this point now, we can select the first channel, channel 1, intensity, highlight that, and increase the amplitude to the desired physiological response. And next, select channel 2, intensity, and increase that channel to the desired physiological response. And as you can tell, since we're on continuous mode, the treatment time has begun. We have the protocol on the screen. We already have the intensity on both channels and on both electrodes active and stimulating the patient. But what I want to do now is actually incorporate a functional task with this particular protocol. So all I'm going to do in this case, if the stimulation wasn't on, the patient would be very flaccid in this particular condition and unable to get any extension to reach out and do a normal task like reaching out and just grabbing a cup and maybe taking a drink of water or whatever the drink is. So that's what we're going to work on here. While the stimulation is active, he's got some extension. I'm going to have him rotate his hand and have him reach out and try to grab a cup. And then he can certainly just hand it back to me at that point, and we can continue progressing the patient into other functional activities.